Hello, good day everyone. My name is JJ. I've got a question. What if you're a physical therapist and you need to do physical therapy on your own? Because that's what exactly happened to me. I'm a physical therapist for more than 20 years and had worked with many stroke patients through the years in hospitals, skilled nursing units, outpatients, and home health a few times. I had been exercising regularly, play basketball regularly, and goes to the gym at least 3 times a week, and had been trying to eat healthy foods and eat all kinds of food in moderation only. I don't smoke. I do drink occasionally, mostly socially, usually red wine, not in excess at all. However, the roles reverse on June 10, 2019, about 2 months from now, about 2 months ago. On that Monday morning, on June 10, 2019, I woke up as usual, getting ready to work. I went to the shower, and while I was in the shower, had a profound feeling of sleepiness. And as I got out of the tub shower, as I was lifting my left foot, I noticed that my left arm and my left leg was slower than usual. I asked myself if I had a stroke, but I remember one neurologist said that when she had a stroke, the child, her brain became quiet. But when I look at myself in the mirror, I could still hear all kinds of chatter in my head. But I had this overwhelming feeling of sleepiness. The only thing in my mind was that I need to lie down. So I went back to bed and lay down for about 3 minutes. I got up, put my working clothes on, shoes, and socks. Then my fiance noticed that I was moving slower. I walked to the living room where she could see my face, and she noticed that it wasn't looking normal. I tried to tell her. She asked me if I was okay. I tried to tell her I was okay, but in my mind I was okay. But when I tried to speak the words, I had a slurred speech. I began to recite the phrase, "The quick brown fox jumps over the lazy dog near the bank of the river," which to her sounded gibberish. And she became alarmed by that. She called 911. And when 911 came, after about 10 minutes, I was back to normal. I was walking and talking normally. In fact, I walked and talked with the paramedics on the way to the ambulance. I almost decided not to ride the ambulance, but they persuaded me because my blood pressure was high. I went to the emergency room, still feeling normal. CT scan was done, which was normal. They gave me water and cookie to test my swallow, which they did fine. No coughing, no choking. So the whole day I was admitted in the hospital. On the whole day I was there. I was walking and talking normally. I could even flush the toilet with my left foot, indicating to you that I had a very good balance then. However, on the second day, the weakness returned and my slurred speech returned. I was I was feeling weaker at this time on my left side. I still thought that I got away with stroke. On the third day, the weakness became more profound. I couldn't move my left arm anymore. I couldn't raise it up anymore. And my left leg, I couldn't sit up on my own anymore at the side of the bed. I couldn't walk anymore on my own. I was, by this time, I said to myself, Now I had become a real stroke patient, the very patients that I usually treat almost daily. I have to accept the fact that I am now weak on my left side and may not be able to walk normal or go back to work, at least. I stayed in the hospital for 1 week. After that, I went to inpatient rehab for 2 weeks where I did my therapy, PT, OT, and speech. By this time, I am placed now on mechanical soft diet and thickened liquids because I choke. I cough on regular liquids. I can't drink regular water anymore. I am making this video and it is an education and inspiration to others and help give tips to others who are suffering the same fate.